Welcome to our weekly show, The Healthy Show. And today we are here to discuss about cancer. In the recent days, there has been a lot of cancer deaths. Starting with the first death, the one that occurred about the Safaricom CEO, that is Bob Collymore, then followed by the Kibra MP, and then recently the last death was about Joyce Laboso, the governor for Bomet, and those are just some public figures that we know about cancer. We are not, it's not all about the public figures. We don't know how many numbers here in Kenya, the population that is suffering from cancer. So today I am joined by a cancer expert by the name Dickens Ngicho. He's going to talk to us about cancer. Welcome, Ngicho.
Thank you so much for having me on the show.
You're welcome.
Yes, so thank you and again for introducing me. As an oncologist, what I can say is that the upsurge of cases of cancer that we are lately witnessing in our country should be or is associated in a great deal with our lifestyle, how we eat, the kind of foods we eat. And because, a long time ago, in the past, we eat a lot of plant food, and there wasn't any form of a lot of refrigeration or chemicals to put into this food so that their shelf lives are lengthened. The other day, I visited in Sokarino and traveled how butchers and some supermarket outlets are using some bad chemicals to preserve food. Yeah, these chemicals are being put in large quantities, and this, is not good for our health. So I think it's going to come back to an individual, get to know the kind of food you eat. But I would advise members of the public to consume a lot of plant food, and we shouldn't store our foods for long in the refrigerators or use chemicals that we are not even sure of how much of the effect they can bring to our body.
Okay, let me ask you, just the other day, there was a report that a man who was diagnosed with cancer took away his life. Now, is it the reason as to why people are taking their life? Now, people want to think that now that these prominent leaders cannot manage to survive with cancer, so they take it down to themselves that now if prominent leaders cannot survive with cancer, I myself am not able to survive with cancer, now that they don't have enough funds to take care of their medical, or is it fear of cancer? What's your opinion on that?
It's fear of cancer, and the capital that one thinks about going to invest in, trying to make sure they go through the treatment stages and come out alive. So somebody asks themselves, if the governor of Bomet has enough money,
has everything
to go to any particular hospital in the world and have themselves treated, the one who dies. So me as an individual who probably earns about 20,000 or less, how am I going to manage to go through
chemotherapy?
Yeah, we have you have
scanning.
You have to be scanned. You probably may be referred to go to India or any other good hospital out there, and you are supposed to look for funds for transport and treatment and staying there. So it depresses someone when they think about all that process, so and then they would still not come out alive.
Yeah, so it's all about depression.
In a way, it depresses when you think about how you want to go through that process of getting treated, and certainly for them, they are certain that they may not come out alive.
Okay, yes, thank you very much. So I am going to be showing you a video of a person that the father took away his life because he thought that he cannot survive with cancer. See you in a moment.
Venye nilikuwa namwangalia tu ni kama alikuwa anaogopa kufanyiwa operation, lakini yeye alikuwa anajua wiki nyingine ya kutoka tarehe 11 ndio atafanyiwa nini operation. Akasema yeye bibi yake asiulizwe swali, yeye amejitia kitanzi juu ya uchungu.
Cancer has been described as one of the most feared diseases in Kenya. This comes after the increase in number of deaths caused by the disease. This calls for Kenyans to take care of whatever they consume and look at their living lifestyles. Joseph Gashau, Health Living.